I thought the article was really unique in that it focused on a group that hardly anybody has looked at, and that is the partners of people in the support groups. We know that cancer is a family disease. There's no question of that. And in prostate cancer, it's particularly striking because the impacts of prostate cancer strike at the very heart of many couples' reasons for being a couple. Their sexual functioning, the intimacy that may be lost, many of the things that prostate cancer does affect a relationship, not just one member of the couple. So I really like the fact that the paper was thinking of prostate cancer as a family disease, as a couple's disease, and thinking about how support groups could actually be responsive to that perspective. So the fact that there are women who are attending these prostate cancer support groups, who are serving important roles in the groups, gaining benefit for themselves and for the men in the group, I think was really quite striking and significant. In the prostate cancer support group that I observed and did research on, I found that women were not as integrally involved as the women in the study that has been reported. They did fulfill, I believe, the 3 roles that were identified in this article. They were in the background. They were co-leaders at times, and refreshments, of course, is something many women are quite comfortable with providing. And they are co-survivors, I think, almost by definition. So there were women in the groups that we observed that did fulfill these relationships, but they were much more in the background. They weren't as front and center as in the groups that you observed. I think that women can fulfill those roles, but somehow I don't see those roles as being the domain of women. In the group that we looked at, the men were facilitators and background supporters. Men actually were in charge of making the coffee. And so I'm not certain that in every group that same distinction will be gender specific, that men do this and women do that. But I think all 3 roles are part of the effective functioning of a support group. I think that participation in support groups has a lot of positive benefits, but only a few cancer survivors and their families take advantage of participating in these groups. It's been pretty consistent that just a small percentage of cancer survivors actually are in groups. So should we be thinking about how to improve that? How can we make this available to more people? I believe that to address that issue, we have to think, why do people join support groups? And what are cancer survivors most concerned about? With respect to what they're most concerned about, a lot of research, including my own, indicates that fear of recurrence, cancer coming back, fear of another cancer coming, that those are the things that really are the most important concerns for cancer survivors. Now, can support groups address those concerns? I think the answer is yes, but not probably as a function of just being in a support group itself. There was some data a few years ago that indicated that people in support groups lived longer than people who weren't in support groups, matched for all kinds of characteristics. But that hasn't been actually supported in a bunch of other studies. So I think probably support group membership per se may not lead to more survival. However, what you learn in support groups can definitely make a difference. So we know what can affect recurrence, things like keeping a healthy weight, increasing exercise, eating well, managing stress. Those are all things that you can learn a lot about by being in a support group, by building on the experiences of other people, knowing what works, what's worked for them. I think that support group participants can get great ideas for how to improve their overall health. Now, the benefits of support groups for quality of life are well established. Effects on things like depression, well-being, social support, all of those things are well established. But I believe other side effects, learning about how to live healthy lifestyles, could also impact survival time itself. So for that reason, think about joining a support group. It's something that I think is beneficial for many patients, many family members, and really is something you can do for yourself.